Thank you, ma'am. Okay.
Have you actually made your motion yet, Pat?
Yes.
Yeah, Tom Terry made it for me while I was in
That's
the
correct.
I seconded.
And Sharon seconded. And we're now in discussion.
I'm going to lead the discussion, but I want to introduce, there's Dr. Derricker is back here. He will come up shortly, I hope, and talk about the intricacies involved with the process. He volunteered to do that. We also have three members of the committee. Steve Cohen is here, and Tom Butler, and Dick. Gail's here too. Okay. Good. So if they have any questions, we can ask them also.
I think we'll begin our discussion first.
Well, if I can just say a few remarks.
I'm sorry. Yes, you may.
Let me say that we do have a plan document if somebody wants to know about the plan document. And it resides in our general manager's office electronically, and it's 142 pages long. I defy anybody to tell me what's in that document to any degree of specificity. However, this plan here doesn't really have to do with the document per se. It has to do with models. So we're going to be talking to many people. If I know the board has read through some of these, and stage one, we're going to be talking to elected officials and other volunteers, staff, external stakeholders, others. Those are going to be the people who will be working on this document. I know Mr. Reynolds raised the point that we're going to make the decision. No, the board will make the decision. However, the people, the stakeholders, will make the decision as to who the board is. So that's the top of the mountain, so to speak.
Association members.
Pardon?
Association members.
Association members.
Not stakeholders.
Oh, that's
People
the
that
same.
What
vote.
the stakeholders? Same thing.
Let's not quibble over words. Let's go.
Anyway, so to make my story a little shorter, Jerry has done an excellent presentation showing us how it works. It's like a three-legged stool. You can't have one of the legs. One of the legs disappear on you. You have to have the situation the way he proposed it. You need to have the people involved in it, which are the stakeholders or the association members, whatever you want to call them, involved in the process. So with that situation, I'd like to ask Dr. Derricker to come up here and just walk us through a little bit about what the stages are and how it works. And somebody asked me also, how much does it cost? Well, that's a good question. The answer is the total cost of the study is $33,000. However, we have a special grant from Salisbury University in the amount of $16,500, or half of it. And when we do stage one, that's only $8,250, and stage two is $8,250.
Yeah, Pat, if I may, where you have motion and it's been seconded, okay, you give background for the motion. And now the time is for the board to ask questions or have discussions. And I think the first question that was brought up, and we're going to have to get to it, and no sense waiting to get it, is exactly where does this money come from? It's not explicit in the budget, you know that. Now, it's been brought up that there are other things that are not explicit, but that when we passed the budget for the reserve study, we didn't know how much that was going to cost exactly, we still don't. And we allowed two, because I didn't know what they were, but I brought up the fact that the other possible small studies, engineering studies and so forth, that would be required to support the CIP as we move along. Don't know what they are, don't know how much it will cost one day. But, you know, it's reasonable to project. We decided that rather than set aside some money for that, incorporate that into the reserve study, presuming that the reserve study won't cost $50,000. Now we have an explicit amount, and given that all of these things interrelate, I don't have a big issue with this. But now we have an explicit amount of money that we're going to ask, which would be a good part of $50,000, without knowing what the reserve study is and what the other things are. And I have an issue. I mean, I have a problem. But, so, I also have, I've read this, and pretty carefully. I have to admit, and I did hear Dr. When he came over, and you had your discussion of comprehensive planning. So when I look at this, I do have difficulty envisioning exactly what these things mean in practical terms.
Well, I think it's appropriate that, Pat, you asked Dr. Derricker to come up. Perhaps he could give us a brief synopsis of what this study would entail. It sounds like it's certainly a valuable part of the three-pronged approach that we have.
A comprehensive plan. Yes.
I'd like to hear from him.
Well, yeah, we talk about stakeholders. Is there any drive to get half our population involved, people that don't live here that pay the same dues as we do? And we're talking about stakeholders. Who drew these 9 questions up? I mean, it's the first time I've ever seen them, and I'm a state. And number 9, should we be a municipality? God help us.
Well, yeah, I had the same issues with questions, and we should address them. Why don't we proceed in order? We'll ask Dr. Derricker wrote the first part of the proposal, and not the 9 questions, and then we can get to
Dr. Derricker? Thank you.
Thank you for giving us an opportunity to share our proposal with you. This request for us to work with the Ocean Pines Association came to us well over a year ago, and we met with a number of people who were looking into the comprehensive planning effort, and some of them had heard of the work we do in strategic planning for nonprofit organizations, government agencies, and private corporations that we have been doing here on the shore for the past 26 years. And a major component of our services includes this tool called scenario analysis, scenario planning. The most difficult thing when you're doing long-term planning, such as comprehensive planning, is having a good idea as to how the future is going to be, how the various decisions you're going to make are going to have consequences, fiscal, financial, various consequences. It starts with understanding the vision, deciding on certain future scenarios, and then understanding how each of those scenarios in the future would yield results. This kind of analysis has been available to Fortune 100 firms for a good 20 years now, but it was too expensive to bring to the level of smaller organizations, nonprofits, to government agencies. In the past 5 to 7 years, advances in technology, work that has been done in various universities, including ours, has brought the cost and the availability down to pretty much everybody. Prior to the use of these kinds of tools, when you're looking into the future, you look at what potential changes are going to happen and take them one change at a time to be able to understand how it would happen. For example, you get what's going to happen to interest rates, to look at your borrowing costs, you get the growth rate of the community, weather patterns to do with bad snowstorms or hurricanes, etc. So it's difficult to look at things happening simultaneously. What if the interest rates go up while our population goes down and there's a hurricane then? Those kinds of complex futures can only be analyzed using scenario models. These are essentially models that understand the community, that's the phase one, that, and then looks at specific scenarios while different variables within each scenario change. As I said, changes in the road system, an HVAC system collapses, there's a hurricane that year, etc., etc. It does not give you recommendations. It does not tell you this is what you should do. It only answers a series of questions every time you ask what if and move different variables simultaneously. In other words, it's a tool for you to support your decisions, to answer your questions. I was listening to your earlier deliberations. A good 75% of what you deliberated on this morning could have benefited from having this kind of a tool in front of you, because it would have answered some of those questions instead of allowing or requiring other people to make guesses about the future. The predictive accuracy of these tools, that again we've been doing this for many years now, is anywhere from 87 to 92%. Why is it 87 to 92%? Shorter you are in the time frame, it's a higher predictive accuracy. Longer you go to the future, the unknowns become higher. It's a tool to reduce uncertainty. It's a tool to understand risk. Most importantly, it's a tool to understand consequences of particular decisions. It doesn't answer for every decision, but for the 3 to 4 scenarios, general scenarios you put together, it does answer these questions. A couple of comments. There was some question that was asked about the 9 questions. In fact, those are not ours. That there were some of the issues that were brought in discussions. Would this tool be able to answer some of these questions? We included them to say that, yes, this tool would be able to answer those questions. What the tool will do for you, you decide once you have it in front. It's no different than a calculator. Whatever numbers you want to put into it, it's going to give the answer to that. These are simple, some examples of kinds of questions it would be able to answer. And finally, I wanted to make a comment about the cost. We will be offering a 50% reduction using internal sources. Main reason for that is that you will be agreeing to us using this as a learning tool for our graduate students, for our MBA students, so that when they graduate and go to other corporations and other organizations, they can use the same kinds of decision-making their employers. Be more than happy to answer any questions you have about the tool. As you see there, it will take about 10 to 12 weeks to do one phase. Then the board would make decisions about the scenarios, and it would take another 10 to 12 weeks at the other end to do the second. We're a state institution, but this particular institution, Beacon, is not funded by the state. It recovers its own costs, and we don't compete on price with the private sector. In other words, whatever the private sector charges, we charge the same thing. It's a little bit like a clinic in a hospital, in a university hospital. This is the place where our graduating students do their internships, their practicing before they go out and become physicians themselves. So just like that clinic charges for its services, we charge our services. But because you're giving us the opportunity to work with not yet graduated MBA candidates, we are providing internal funds, part of our educational dollars, to be able to study. The study, once the tool is available to you, there's a 12-month aftercare period during which we're available to charge to help using it. And after that, if you want us to come back, be able to come back on a simple hourly fee basis. So those are your financial consequences. As I said, even though we are a state institution and even though this is a self-funded operation, we're not going anywhere. You're not going anywhere. If you don't have it in the budget, you still want us to do it, we'll do it whenever you have the money paid for it. It's not an issue for us. The thing for Beacon is that the students get to learn from this and get good jobs on it. That's what drives our piece. One final comment. I've said this in one of the previous meetings. I'm an uninterested third party here. I honestly have no stake in this particular activity. As was mentioned, I don't reside here, although I do have a soft spot in my heart for the community. My mother used to live here in Teal Circle, and I love this community beyond words can express. So if you choose to work with us, be delighted to do that. Be a good excuse to keep coming back.
Yeah, let's go down the table.
Okay, that's good. The actual output of stage one, as I understand it, is actually in essence 2. You get the results of the interviews and focus groups that are provided to the comprehensive planning committee as input.
Correct.
But the actual tool with the data mining and all of that goes on comes after stage 1, right?
Right, because after stage 1, we will come up with potential scenarios based on what stage 1 told us.
Okay.
Then you all would have to pick 3 to 4 of those scenarios for us to build a model. The model is built on scenarios. It's not a generic model.
Right.
So you as decision makers would have to say, of the 5, 6 scenarios that have emerged from phase 1, these are the ones we're interested in.
So phase 1, stage 1, as I see it, as I read, and I've done these things in economic development, so I understand where you're coming from. This is basically gaining input from our members. When you
Correct.
say stakeholders, you're talking about the members
Correct.
of the association.
Absolutely. And the reason we said that is earlier on that somebody would have made a comment. There's a differentiation between your members who live here
Yes,
and your members who are not
that
residents.
was going to be my next
I,
question.
in stakeholders, I'm capturing that larger.
Now, in reference to these questions that have worked on, this is a sample. This is not
These are the kinds of
not a
things.
finished document at this point.
No, in fact, if you decide to work with us, what happens is we get together with the comprehensive planning committee or whoever else you appoint to design the scope of work. That scope of work goes into the document that becomes our contract.
If I can add to that, I think the questions, and I looked at it before too, they're made up by former committees. Current committee didn't make these questions up.
No, this is just simply like I said. These are the kinds of things these models answer. They came from this organization, this community. So I gave them as examples. As these are the kinds of things it does. You all decide in the scope of work. These are the kinds of things we're interested in. You're not interested in something, don't put it there. You're interested in something else, put it in there. The process is not dependent on the questions. As long as you don't ask me what weather is going to be next week.
For the winning lotto team.
As Ted so honestly pointed out earlier, I'm old, been around a long time, negotiation fines. I just wanted to mention we've got history with Salisbury. You guys did our demographic study, I think, 70, and it was
A
really.
little later than that, but it was
Oh, it would have been 80,
Yeah.
90.
something like that, yeah.
You did a demographic study for us. It was great work. I mean, it was top notch. And personally, I think this is important. The problem is, in our planning, we do a budget. Hell, it isn't 30 days old. It's not in the budget. It's not in last year's budget. So, I really can't support the motion based just on that.
Vice President Clark, we're here now. We're here. We were here last year. We will be here next year. Whenever you're ready, budget or otherwise, we're here.
Thanks.
Dr. Derricker, you were here maybe 2 years ago, the Budget and Finance Committee, and you gave a very detailed approach, and I appreciate I learned a lot then. If I understand it correctly, what you'll be doing when we have these questions, is it like a sample? Is it an email? Is it a voting thing? How do you get answers from the people?
We start with focus groups. We work with, again, the community to determine a smaller group of people. This is sometimes referred to as the fishing expedition. It's before you start a survey, you do this conversation to see what some things are going to bubble up. And you do the separate kinds of, you do it with employees, with elected officials and volunteers. You do it with residents in different settings. That then determines what the more in-depth questions are going to be. Then we select 30 opinion leaders, or it can be more or less. It's depending on our conversations with you. We do in-depth interviews with those individuals. These can last anywhere from 20 minutes to 40 minutes, and they can be done over the phone or in person. And based on that, we design a survey that goes to everybody that you have an email
So
address.
all members of the association will have an opportunity to
Correct.
respond to the survey.
Now, one caveat, if there are members of the association paper copies,
Yes.
this proposal does not include the cost of mailing those. So you would have to take that on. But electronically, we'll take care of everything if you have email addresses.
Good point. Thank you.
We have in the budget to do a reserve study. I'm just afraid that doing both of these at the same time, I would think that reserve study would be important for this process. So, doing both at the same time, I think they counteract each other, and I'm afraid I think we should do the reserve study first and then move into this.
I don't know. I don't know enough about your particular situation. My recommendation always would be to do them simultaneously so that they can benefit from cross-fertilization. And again, the funding for us, the timing of the funding is not an issue. We can craft a contract that says if and when you put this into the budget is when put the file. You can start up with a $1 retainer or something. There are many ways to handle that if that's the problem. If you still want to wait a year and still want us to do, as I told Vice President Clark, we're here, we're not going anywhere. We were here 2 years ago, we were here last year, we were here today, we'll be here next year. Whenever you're ready, we're ready for you. The price might change a little bit because, not because our costs are, we're going to charge you more, but the software we use is an annual license, and if that price goes up, I would have less negligible.
Bob? Next question.
Well, Dr. Dereker, it's good to see you again, sir. I thought your last two presentations were very good. The only question I have, based on your prior visits with us, the report we get or the output we get is only as good as the questions we ask.
Correct.
Correct? So the quality of the questions really determines what the end result, whether it's useful, whether it does us any good. So the biggest concern I have is your process to help us come up with the best questions so the output is something that's actually usable for us. Because if you put bad information in,
Garbage in,
nothing
garbage
else
out.
matters.
GIGO,
And that's where my concern 2 years ago, this year, I believe something that's interesting, and I think it would be helpful for the community as we're trying to look at 10, 20, 30 years out for planning purposes. The unfortunate part is my biggest concern is the input that we share to get the quality of report. Look, how do you help make sure?
Very, very, very valid concern. That's why it's a two-phase study. In phase one, not only are we collecting information, we're also using our knowledge of best practices elsewhere in similar situations to guide you in terms of maybe you should be asking this question as well, or maybe that question needs to be formulated in this way. So we provide guidance in formulating what goes in, because having done over 40 of these now in the past few years, we know that certain questions are too broad. Or other questions are actually two different questions that are clumped together that the machine doesn't like because it wants to answer this and this separate. So we provide that guidance in phase one. That is the reason for having a phase one. Make sure that what goes into the tool is solid information. Furthermore, the tool is almost infinitely adaptable. In fact, one of the values of it is that it's adaptability. So in its usage, let's say second year you're using it, you realize that a certain type of question needs to go in. It can be very easily tweaked. It's all done based on sliders and spreadsheets behind it and simulation models. It wouldn't take but an hour or 2 hours to add a question, take a question out, or tweak it.
And correct me if I'm wrong, this series of initial questions is 5 to 6 for the input ones.
The scenarios.
Right?
Scenarios, yes. Okay. So a scenario can have multiple pieces, and on the tool, I wish I had brought a copy to show you, but it's tabs. So you can do this tab, that tab. We've done these things from a $400 million cargo complex at JFK Airport to the entire workforce development model for the state of Oklahoma. We're doing it now for the state of Rhode Island. We just did it for the state of Maryland. We are Monday signing a contract for Department of Human Resources, almost exactly like this, only bigger. That one's a $160,000 project. So we have gathered a little bit of expertise in how to tweak it so that the right questions go in and build enough flexibility that you get the right kinds of answers. Anytime you reduce uncertainty, anytime you increase the ability to predict outcomes, and anytime you build a way to deal with unintended consequences in the future, your ability to make better decisions is going to be enhanced, and that's all this is. It doesn't make any decisions for you. You still have to make decisions.
Thank you, sir.
To answer one of your questions, Bob, if it wasn't answered, that what are the focus groups, the responsibility of the committee to try to get together people, probably most of the people in the room, especially Joe. Probably most of the people in this room will be on those focus. Because those are the people that are taking an active interest in what's going on in the community. That's who we want to have. Jeff Never will be able to do it.
You can talk about it,
Yeah.
but you gotta have non-residents involved.
Well, okay.
Yeah, we include them in the
Sure.
Yeah, Jeff, if you want, briefly, we'll open the floor. We'd like to move this thing along.
Yeah, let me give you just a very brief little context. The reason that the study wasn't in last year's budget is because I was the liaison and I screwed up. I had just joined the board. We were just doing budgets. I wasn't bright enough to know that I needed to put it in. So that's how it didn't get in last year. This year, you're on your own.
Same thing.
That's the other thing is the focus on the questions is very appropriate, but don't get hung up on the 9 that are on a piece of paper. Okay, they're there because it's dumb to start with a blank sheet. Okay, it's much better to start with a list of reasonably relevant questions that I believe your phase 1 tunes up. Okay, so don't get hung up on who did those or what they are. It's a starting, and they aren't the real questions. I mean, they might be, but they aren't the real questions. And there was a fair amount of energy used to generate those questions by the comprehensive plan. Okay, they were not dartboard questions, and they were not just anything you want to ask. I was the liaison. They talked about it, and they came up with these questions. So that's decent work. And then in working with them, we will get to what are the real questions that then generate this.
The contract determines that.
Yeah, that's right.
I think it's not a comprehensive planning committee effort to do this. I mean, it is, but it's not only comprehensive. Joe?
Brief comment. My concern about the questions is that, Doctor, last time you were here, I recall you saying that the most important part of the whole process was the question. And then you said, and I brought it up in public comments at the time, and I said, well, questions then are somewhat political. You replied, indeed they are in many cases. So, do we have a comprehensive plan committee? I think anybody on this board would agree with me that any one of you, me or Jeff or anyone in this community who follows this stuff close, that I could find 50 people in this community to appoint to have this gentleman and his crew interview, review, and so on, and somebody else would get another 50 people, and we could come up with entirely different 6 or so questions. This is what bothers me. I don't know how, if this is going to be worthwhile. I mean, the question here, should we be a municipality? That's one that bothers me right off the bat, because I don't know of any push in this community to do that. So we could answer that question very easily. Send it out in a referendum, asking for more.
Yeah. Well, I think what Jeff said.
I'm just troubled by the process and the politics involved, as opposed to the science involved. That's my problem.
I hear you, and again, this is not the first organization where we're doing this. Whether it's a nonprofit organization, a government agency, or a corporation, there's always politics. And all I can say is we have tremendous amount of experience knowing how to take talk. More than that, it's followed by a census survey. So the questions you all are going to tell us, we're going to then do the process. It's up to you.
Okay, well, thank you very much, Doctor. If I can, I'm just going to make one comment. I've lived all my life as what they call a systems engineer. A systems engineer doesn't know anything. He just looks at the gazette as a gazettis. That's it, by definition. Into a model which will have interrelationships and which will be governed by external factors. And I'm assuming, that's what you're talking about. Defining those interrelationships can be very difficult, but on the other hand, given your experience, I think you probably can guide us into that. So I'm in favor of it.
Ted's trying to say something.
And I want to done some math. I don't believe it's possible to spend $34,500 on a research study. We have 50 in the budget. I would not be opposed if there's a consensus that we take the 16.5 away from reserve study, which is
Well, we just put down a number.
And then I could probably support this. I can't support it. I would take that of that portion
Okay.
or some other portion of the budget.
Okay, where is
And then Ted,
Ted?
Yeah,
over there scheduling?
my main questions were whether, how you pay, but you can always, whether you come to your report or not, saying you pay $1 now, the 1,000 or 15,999 next May, whether you would want or could you cover it. But the second
I'll
thing
vote for
is,
that.
yeah, you won't be sitting there. The second thing is whether is to make sure, just as Joe has said, Bob has said, everybody said that you have some control and make sure you feel comfortable with the question. The third question is that nobody's asked is the members of the Comprehensive Planning Committee, how critical is this to you being able to give us the information we need in order to finish the CIP? Because if we don't have that, are we going to miss the one leg? So that's the third question, CIP problem. I mean, the comprehensive.
My committee's been working on this for
This is Steve Cohen.
Steve Cohen. I'm the chairman. We've been working on this for 4 or 5 years. We don't have the expertise to do what we need to do, getting information. Dr. Derica has all this database, all this information. How many people live here, how many renters here, how many people use diapers, the whole thing that we don't have access to. And we really can't do our job. We can't go any further without this information. And you can look at it as spending money, but you have to look at it as an investment. This is for the future. $8,000 for the next 10, 15 years is peanuts. And it gives us direction of where we want to go, what we want to do, and as Jerry said and everybody else said, it fits into the whole process, the synergy. We can't do one without the other. So all right now is we're contracted to pay $8,000 to get the $4,000 to get the information. Then we, as a comprehensive committee, will work with Dr. Derica very closely. We'll have monthly meetings. We will determine through our contact table who the stakeholders are. Okay, with discussion, with his expertise, and with our knowledge of who's the movers and shakers in the area, we will get the stakeholders together. And then determine, everybody has an interest, everybody has politics, okay, everybody has their own agenda, but through his expertise, he'll be able to filter through it and develop a scenario and it's a living document. So every year, when something happens, we can change it based on his data, because he has the data. If the population's going older, next 5 years, we can put it in.
Okay, thank you, Steve.
Thank you.
Okay, I'm going to call the question.
But what's the question? How are we paying for it? That's my hang up.
These-
If we're taking anything out of that reserve study, which I want that reserve study to be comprehensive, and we said it could be up to $50,000, I don't want all of a sudden say, okay, now we only have $35,000, so let's not do quite as comprehensive
question. Yeah,
reserve study.
I think you're correct. But we didn't know that it would be $50,000. Now what we're doing is taking risk and saying that $35,000 based on experience would be a reasonable. And we'll find out. And again, that will be, we won't know that either until we get the RFP to find the scope reserve study. Because, Ted indicated we can narrow the scope somewhat based on the information.
And the only difference between new reserve study and the old one is the old one didn't do roads. I don't know if it did. So you're going to add some things to it. If we ditto the 08, when I did my research to make the motion, the company that did it the last time was in the $12,000 range, not roads. I thought roads would be a substantial amount of money, and they said, no, we'll take more samples and have roads done. We're not going to look at every inch.
Mr. President, the discussion we had at the budget meeting, rather extensive when it came to this, it came to $50,000 pattern remember very clearly the discussion around the fact that this study could be funded possibly out of that, since we didn't know what the reserve study was going to cost. This could be funded out of that. The other piece of this, and the reason that I'm for it, it has the dollars come from wherever they come from. Reality for me is that this chart clearly shows you've got to have all three legs of the stool, and you just heard from the chair of the Planning Commission. Sorry, the wrong name, but you just heard from the chair that without this tool, without the guidance of an independent voice to help work through the politics, and it also allows for the thing that I know, Bill, you and I are both concerned about on the reserve study, is that you can't just do a reserve study on what you've already got. You also need to know what else you might need to build. And without that third leg coming out of the comprehensive plan group, you won't know that. And I'm not going to throw out an example because next thing you know, it'll be Tom Terry wants to build another thing. And the reality is I don't know what the other thing is. But the comprehensive plan will look as a visionary and say, we need X. We think we need it. So to me, somewhere, it's like priming a pump. You got to prime this cycle somewhere. And this begins the cycle. To feed into the reserve for the CIP, back to there. Somebody's got to kickstart this thing. And here is a very, and quite frankly, utilizing students and grant money to help pay for it.
We're about to lose a
So I'm
member.
done.
We're about to lose a member, okay?
And I'm not mad at anybody. I
No,
have a
just-
meeting at 1 o'clock.
Yes.
So call the question.
I'm going to call the question. Here. All those in favor of proceeding with the motion, say aye. Aye. Opposed? One opposed. Okay. All right.
I'm for everybody that wants to be on the committee.
Okay.
See everybody later. Sorry, I got to run.
About what we have left. We're up to, liaison reports.
Did media.
We'll get to that. We got appointments first. We have Tom Butler, Ken Wolf, and Kathy Ryan. Why don't you go down?
There's also two more.
The two we added this John
Steve
O'Connor
Smith and John O'Connor.
John O'Connor and Steve Smith.
Will they all be accepted?
Does anybody,
I move they all be accepted.
I'll second.
all in favor?
Aye.
Okay, media questions. Oh, good. Okay, do I have a motion to adjourn?
You got it.
Second.
We're adjourned.